President Obama is probably kicking himself tonight. He said something that he probably regrets big time. Remember when President Obama made this offer?
I just want everybody to know Congress will have time to read the bill. They will have time to debate the bill. They will have all of August to review the various legislative proposals. When we come back in September, I will be available to answer any question that members of Congress have. If they want to come over to the White House and go over line by line what's going on, I will be happy to do that.
Line by line. Congressman Phil Rowe wants to take President Obama up on that offer, line by line. Congressman Rowe is also a doctor and joins us live. You're going to take the president up on his offer?
I certainly hope to. We sent a letter to the White House today suggesting that we do just that, and I hope he invites me over. You really go over to the White House and go through line by line? I would certainly do that. I think it's Greta.
How does he get out of this, by the way? I'm thinking, how does the president save face on this one?
I don't know. I'm not worried about him saving face or me saving face or whatever. What I really want to see happen is that we understand this very complicated plan. It is extremely complicated. And I've spent 31 years in the practice of medicine. This is very complicated.
Well, see, that's why I call it the coffee summit, because now he's got to because look, I've started to go through this. It's not the most exciting to me. It's extremely important, but it's not the most exciting. Practically, I think in some parts it's incomprehensible. But anyway, maybe I just don't understand it. But I think the two of you are going to need an awful lot of coffee if you're going to go line by line. But oddly enough, I think that's important, and I'd like to see you bring a bunch of your colleagues over and go through it, too.
Well, Greta, it's the most important piece of social legislation since Medicare in 1965. This will affect every single American, all 300 million of us, in a very, very personal way. And, having practiced medicine, I believe that health care decisions should be made between patients, their families, and their doctor. And this particular...
How about insurance companies?
Well, they're not on my Christmas card list, I can tell you. There needs to be insurance reform. That's something we both agree on. I certainly agree with the president. And when they brought this public option out, that's the big stumbling block, is how much are we going to inject the government into a personal decision made by you and your family. And in Tennessee, we had a plan back in the 90s where we wanted to increase access and quality. And it was called TennCare. We got a waiver from the HHS to do this plan. And what happened was the state was spending about $2.5 billion per year on health care. 10, 11 budget years later, it was up to a third of the state budget, $8.5 billion. And what happens in a public plan, this is where it gets complicated, but the public option, that would be TennCare in our state, paid less than 60% of the costs of the care. And Medicare pays about 80 to 90% of the costs, shifting those costs to private insurers.
Well, it's interesting. I make a big joke and I flip and I talk about a coffee summit and the whole thing about whether the president will really follow through on reading line by line. But it actually is profoundly important that everybody read this, because, as you say, it really is going to, whether it's a good bill or a bad bill, you should at least read it to make that judgment. It's a little bit like saying that picking sides on the police officer, Professor Gates thing. You say, have your information first. Are you willing to attempt to hold the president's feet to the fire to actually go through it with you?
I absolutely am. I came here for one purpose, and it's certainly to represent the people in my district, but I knew this important legislation was coming up. I've spent a career serving patients, and the problem with a public plan is it will ultimately end up, I believe, if you follow the Tennessee model, with a single-payer system. And that the only way single-payer systems work is they ration care. They decide who and how much care is given.
But that's the second question, almost. Before you can even get to the point whether the proposal is good, you got to at least read it. That's where I'm still hung up on. And I hope you get a bunch of your colleagues on both sides of the aisle and take the trip up the road.
I think probably there's going to be a lot of letters tomorrow at the White House.
I hope there are more letters. I think it's really important. Know what you're going to write about and know what you're going to vote on. And I hope the president knows what he's what he's proposing.
Well, this one's too big not to, Greta. It really is not.
It's not naming a national park.
No, it's not naming. No, or post office.
Right, or post office. Anyway, Congressman, good luck. I hope when you get a letter back from the White House, because I'm sure the president probably is furious at himself for making that promise. But let us know what he says.
Thanks a lot. Thanks for having me on.
Thank you. Still